Absolutely, Dr. Rahman. Here's a set of USMLE-style questions focused on podocyte damage and nephrotic syndrome, covering the cascade from proteinuria to hypoalbuminemia, hyperlipidemia, hypercoagulability, and infection risk. Question 1. Pathophysiology of proteinuria. A 6-year-old child presents with facial edema and frothy urine. Urinalysis shows 4+ protein. Serum albumin is 2.1 grams per deciliter. Which of the following best explains the proteinuria? A. Tubular reabsorption defect. B. Inflammatory damage to GBM. C. Loss of charge barrier in glomerular filtration. D. Incomplete filtration of urea. Answer C. Loss of charge barrier in glomerular filtration. Explanation. In nephrotic syndrome, podocyte injury disrupts the negatively charged GBM, allowing albumin to leak into the urine. Question 2. Consequence of hypoalbuminemia. What compensatory mechanism is triggered by hypoalbuminemia in nephrotic syndrome? A. Decreased lipolysis. B. Increased hepatic lipogenesis. C. Increased urea production. D. Increased sodium excretion. Answer B. Increased hepatic lipogenesis. Explanation. The liver responds to low oncotic pressure by increasing production of lipoproteins, leading to hypercholesterolemia. Question 3. Risk of thrombosis. A patient with nephrotic syndrome is at increased risk of the thrombosis due to urinary loss of which of the following? A. Fibrinogen. B. Factor VIII. C. Antithrombin 3. D. Protein C. Answer C. Antithrombin 3. Explanation. Antithrombin 3 is lost in the urine, reducing natural anticoagulation and predisposing to hypercoagulability and venous thrombosis. Question 4. Susceptibility to infections. Nephrotic syndrome increases the risk of infections, particularly with encapsulated organisms, due to loss of A. Complement C3, B. Immunoglobulin G, IgG, C. T cells, D. Interleukin 2. Answer B. Immunoglobulin G. Explanation. Loss of IgG in urine reduces humoral immunity, increasing infection risk, especially with Streptococcus pneumoniae. Question 5. Classic nephrotic syndrome clue in children. A child presents with facial edema and frothy urine. Labs show hypoalbuminemia, proteinuria, 3.5 grams per day, normal complement levels. What is the most likely diagnosis? A. PSGN, B. Minimal change disease, C. Focal segmental glomerulosclerosis, D. Membranous nephropathy. Answer B. Minimal change disease. Explanation. Most common cause of nephrotic syndrome in children shows podocyte effacement on EM and selective albuminuria. Rapid review.